All right, today we're diving into this incredible world of surgery. I mean, think about it. The tools are microscopic, the entire workspace is smaller than a dime, and just 1 millimeter can mean the difference between sound and total silence. This is the amazing art of ear surgery. And it all really starts with this huge fundamental challenge, right? Our hearing, our connection to the world of sound, depends on this super delicate machine, and it's locked away inside the hardest bone in your entire body. So, how on earth do you even get in there to fix it? For the surgeons who do this, it's this incredibly high stakes puzzle they're solving every single day. But for the patient, man, the outcome is it's profoundly human. We're talking about the difference between isolation and connection, between silence and hearing the voice of someone you love. So, welcome to the world of otology. That's the medical and surgical specialty that focuses entirely on the ear. And today, we're going to explore exactly how these specialists perform what really are microscopic miracles. Okay, so to even begin to understand how to fix this machine, we first have to appreciate just how incredible its design is. So, let's take a look at the anatomy we're actually dealing with here. So everything we're talking about is housed inside what's called the temporal bone. And a good way to think of it is like the body's own natural fortress. It's incredibly dense, incredibly strong, and for a very good reason. It's got to protect these super fragile organs for hearing and balance. But, and this is the key, that same protection, it also makes it a massive barrier for any surgeon who's trying to get inside. And tucked away inside that fortress, you've got the ossicles. Get this, they are the three smallest bones in the entire human body, the malleus, incus, and stapes. Together, they form this perfect little lever system that amplifies sound. And their combined size, it's about the same as a single grain of rice. Seriously. Now just try to imagine repairing that. So, right, you can't just pop the hood and take a look inside. So how in the world do you diagnose a problem in this hidden, bony world? Well, the answer is all about meticulous mapping. Before a surgeon even thinks about making an incision, they need a super detailed guide to that specific patient's anatomy, something that pinpoints exactly where the problem is. In that map, it comes from two key imaging tools. First, you've got the high-resolution CT scan, or HRCT. That's really the gold standard for looking at bone, so it's perfect for checking on those tiny ossicles. But then you have the MRI. It's great at visualizing soft tissues, things like nerves and tumors. So the surgeon really has to pick the right kind of map for the specific trouble they're hunting for. So what do these maps often reveal? Well, let's get into the common culprits, the things that can actually break this delicate little machine. Okay, one of the most destructive things they find is something called a cholesteatoma. Now, it's not actually a tumor, but man, it sure acts like one. It all starts when skin cells get trapped where they just don't belong, right behind the eardrum. From there, they form this growing cyst that is basically a slow-motion wrecking ball, just relentlessly eating away at those tiny vital bones and pretty much anything else in its path. Another really common problem is just a pure mechanical failure. You see, a healthy stapes bone, one of those three little guys, is supposed to vibrate freely. But with a condition called otosclerosis, this abnormal bone growth basically acts like cement, and it just fixes the stapes right in place. It's like the engine's running, but the transmission is completely seized. Sound is physically blocked, it just can't get through. So we've got destructive cysts on one hand and frozen parts on the other. How do surgeons actually go in and fix these things? Well, that brings us to the surgeon's toolkit. All right, to get that cholesteatoma out, surgeons have to operate on the mastoid. That's the part of your skull bone right behind your ear. And doing this, a mastectomy, involves a really big decision. There are two main ways to go. The canal wall up approach tries to keep the ear's natural shape, which is awesome for the patient down the road, but it can make it harder to be 100% sure you got all the disease. Then there's the canal wall down approach. It's more aggressive. You create this one big open cavity, which gives the surgeon the best possible view, but it means the patient needs lifelong professional cleaning. It's a classic trade-off, really. Preserve the anatomy or go for the most complete disease removal. Now, what if the eardrum itself is damaged? Well, it can be repaired in a procedure called a tympanoplasty. And this part is just amazing to me. Surgeons often use the patient's own tissue to create a living patch. They'll actually take a tiny piece of fascia, that's the thin, strong stuff that covers the chewing muscle on the side of your head, and they use that. They prepare the area, place this little graft, secure it, and then the body just builds a new working eardrum. Okay, but what if those tiny bones themselves are damaged or eroded? That's when surgeons perform an osteoplasty. They use these unbelievably small titanium prostheses to literally rebuild the chain of sound. Depending on which parts are missing, they'll put in either a partial or a total replacement, forging these new links to carry sound vibrations all the way to the inner ear. And this is where the precision just becomes absolutely mind-boggling. Remember otosclerosis where the stapes bone gets stuck? To fix that, surgeons perform a stapedotomy. They create a tiny hole in that bone, often with a laser, and then they insert a microscopic piston. And that hole, it's just 0.6 millimeters wide. Think about that. It is literally like being a watchmaker, but on living tissue. But what if the problem isn't the mechanical parts? What if the issue is deeper, in the inner ear or with the hearing nerve itself? Well, that's where something totally different comes in, cochlear implants. This is a whole other technology. It completely bypasses all that middle ear hardware we've been talking about. Instead, it uses an electrode to directly stimulate the hearing nerve, sending sound signals straight to the brain. So, after all of this microscopic drilling, all this grafting, all this rebuilding, what's the end goal? I mean, what does success really look like in this field? It really boils down to three things, and the order here is absolutely crucial. Priority number one, first and foremost, is a safe ear. That means all of that destructive disease, like the cholesteatoma, has to be completely gone. Priority two is a dry ear. Any holes are patched up, and the ear is protected from future infection. And only then, once those two things are achieved, do we get to priority number three, a hearing ear, reconstructing the whole mechanism to restore that person's connection to the world of sound. And that philosophy is so key. Yes, hearing is the goal, but it's never ever at the expense of the patient's safety. Getting rid of the disease is always, always priority number one. Restoring the hearing, well, that's the incredible, life-changing bonus that comes after. And that really brings us full circle, back to where we started. This was never just about fixing a tiny machine. Our hearing is so fundamental to everything. It's how we communicate, how we learn, how we connect with the people we love. So when a surgeon successfully navigates this impossibly tiny, microscopic world, they aren't just restoring a bodily function. No, they're restoring a person's entire